Here is the fully rewritten script in English, following your exact requirements. Your feet might be sending you clear warning signs of diabetes right now, and you may not even realize it. From subtle numbness to unexplained skin changes, these early signals often appear long before any blood test flags a problem, yet they are dangerously easy to ignore. In the next few minutes, I am going to show you 8 critical signs you should never overlook. Most people still believe diabetes can only be discovered through a lab test. You go to the doctor, the results come back, and suddenly you have a diagnosis. I understand why that belief is so common. For years, that is exactly what patients told me too. My name is Dr. Hidden Stories. What I have seen confirmed in my office week after week is that your body begins warning you about rising blood sugar long before any lab result ever appears. And the very first place those warnings show up is in your feet. The reason I'm making this video today is because I have watched too many patients walk into my office, or worse, into an emergency room, with every warning sign already visible on their feet for months, sometimes years, before anyone connected the dots. They did not miss the signs because they were careless. They missed them because no one ever taught them how to read the language their feet were speaking. That changes right now. Before we go through the 8 signs, I need to give you the foundation. Once you understand why diabetes speaks through your feet first, you will never look at your own feet the same way again. Here is what actually happens inside the body when blood sugar stays elevated for too long. Glucose is the fuel every cell runs on. When insulin works properly, glucose enters the cells and powers every function. When blood sugar remains high, either because insulin is not working effectively or the body is not producing enough, that excess glucose circulates freely and begins damaging the smallest and most delicate structures first. The tiny blood vessels called capillaries and the fine peripheral nerves. And where are the highest concentrations of both capillaries and nerves? In the feet and lower legs. This is why your feet become the body's earliest and most honest warning system for diabetes. The damage starts there first. Nerves lose sensitivity. Blood vessels narrow and weaken. Healing slows down. Immune response becomes sluggish. All of this happens quietly at first, so quietly that most people dismiss the changes as normal aging, tired feet, or bad shoes. They are not normal. They are your body trying to get your attention. Let me tell you about a patient I will call Mr. Harlan. He was a 62-year-old retired teacher who came to see me not about diabetes, but about a small sore on the ball of his right foot that refused to heal. He had noticed it months earlier and assumed it was just a blister from his walking shoes. He had put a bandage on it and tried to ignore it. When I examined his feet that day, I saw far more than one slow-healing wound. His feet were telling a story that had been unfolding for nearly 2 years, a story he had not known how to read. Blood tests later confirmed type 2 diabetes with significantly elevated levels. He had no idea. We will come back to Mr. Harlan because the conversation we had that day about what his feet had been trying to tell him is exactly the conversation I want every person watching this video to be able to have with their own body. Sign number 1, numbness, or tingling in the feet or toes. This is the most common early warning and the one most frequently brushed off. Sustained high blood sugar damages peripheral nerves, a condition called diabetic neuropathy. The nerves that carry sensation from your feet to your brain begin to malfunction. You may feel a persistent pins and needles sensation, or areas of your feet that simply feel less responsive than they used to. Many people blame it on sitting too long, poor circulation, or just getting older. When the numbness or tingling is regular, stays in the feet and toes, and does not fully resolve with movement, it deserves a proper medical check. Sign number 2, burning pain in the feet, especially at night. Damaged nerves do not only lose feeling, they can also misfire. This creates a burning, stinging, or feet on fire sensation that is often worse in the evening and at night when distractions are fewer. This neuropathic pain is one of the clearest clinical signals of established nerve damage from prolonged high blood sugar. If you feel this, and there is no obvious injury or skin condition, get your blood sugar evaluated. Sign number 3, slow healing sores, cuts, or blisters. High blood sugar damages the tiny blood vessels that deliver oxygen and nutrients to the skin and tissues. Healing slows dramatically. A small cut that should close in a few days can linger for weeks. Because neuropathy often reduces sensation, many people do not even feel the original injury. Any wound on the foot that is not noticeably better within 2 weeks needs immediate medical attention. Diabetic foot ulcers are one of the leading causes of lower limb amputations worldwide, and most of them start with a wound that was ignored too long. Sign number 4, persistent swelling in the feet or ankles. Mild swelling at the end of a long day can be normal. Persistent swelling, especially if it is present first thing in the morning or appears together with any other sign on this list, is not. Diabetes affects both kidney function and the small vessels that return fluid from the tissues. The result is fluid buildup in the lower legs and feet. Do not treat this with compression socks alone without first ruling out blood sugar as the root cause. Sign number 5, unexplained changes in skin color on the feet or lower legs. Look for reddish, brownish, or purplish discoloration without bruising, shiny or stretched-looking skin, unusually pale patches on the toes, or dark velvety patches and skin creases, acanthosis nigricans. These are not cosmetic issues. They reflect compromised circulation and metabolic changes in the tissue. Any new or unexplained color change deserves evaluation. Sign number 6, persistently dry, cracked skin on the feet. Healthy foot skin needs good internal circulation to stay moisturized. When blood flow is reduced, the skin dries out, hardens, and cracks, especially around the heels and ball of the foot. These cracks become entry points for bacteria. In someone with high blood sugar, a small crack can quickly turn into an infected ulcer. If your feet stay dry and cracked despite regular moisturizing, and you have any other signs, this is more than just dry skin. Sign number 7, loss of hair on the lower legs and feet. Hair follicles need a steady blood supply. When small vessels in the lower legs are damaged by high blood sugar, the follicles receive less oxygen and nutrients. Over months and years, hair growth slows and eventually stops, especially on the shins and tops of the feet. Gradual hair loss from the knee downward is one of the most specific and most overlooked signs of peripheral vascular changes linked to blood sugar damage. Sign number 8, changes in foot shape or deformities. This is an advanced sign that indicates longer-term nerve and tissue damage. Weakened small muscles in the foot allow toes to curl into hammer or claw shapes, the arch to collapse, or pressure points to form hard calluses. In severe cases, Charcot foot can develop. Bones weaken and shift because the person cannot feel the pain that would normally protect the foot. Any progressive change in foot shape as an adult, especially alongside numbness or poor healing, needs urgent specialist care. I promised we would come back to Mr. Harlan. After his diagnosis, we created a clear plan. Blood sugar management, proper footwear education, regular foot checks, and daily self-examination. 18 months later, the sore on his foot had healed completely. His blood sugar was well controlled. The numbness he had been dismissing for over a year had stabilized and, in some areas, even improved. He looked at me and said, "Doctor, my feet were screaming at me for 2 years. I just didn't know the language." That is exactly right. Your body speaks. The feet speak first with diabetes. The language is specific. You just need to know the words. That is what this video has given you today. Let me bring it all together clearly. Your feet can show 8 important warning signs of diabetes long before a blood test confirms it. Numbness, or tingling that does not go away. Burning pain, especially at night. Slow healing wounds or sores. Persistent swelling in the feet or ankles. Unexplained changes in skin color, dry, cracked skin. Despite regular care, loss of hair on the lower legs and feet. progressive changes in foot shape. You do not need all 8. Even 1 or 2 appearing consistently is enough reason to see your doctor and specifically request a fasting blood glucose test and an HbA1c. Here is your action step right now. Take off your shoes and socks and truly look at your feet, perhaps for the first time in a long while. Check the skin, the color, the texture, the toes, the heels. Notice any sores, swelling, or areas that feel different. Then ask yourself when you last experienced any of the signs I just described. If anything on this list applies to you, do not wait. Book an appointment this week and ask for proper blood sugar testing by name. Which of these 8 signs surprised you the most? Or which one did you not know before watching this video? Tell me in the comments below. I read every single one, and if someone you care about has any of these signs right now, please share this video with them today. That one share could be what gets them to a doctor before the damage becomes irreversible. Subscribe for more honest, clearly explained information about the health topics that matter most after 50. The conversations your doctor sometimes does not have time to finish. I will finish them here. This is Dr. Hidden Stories. Your health deserves the full picture. Disclaimer: everything shared in this video is general medical information based on published clinical research and medical practice guidelines. It is not a substitute for personal medical advice. The presence of one or more of these signs does not confirm a diabetes diagnosis. Only a qualified medical professional can diagnose diabetes after proper testing. If you have concerns about any of the signs discussed, please make an appointment with your doctor and request appropriate blood sugar testing.